This particular report is all about tackling the social determinants of health, which account for more than half of the variation in health outcomes across local areas. Healthcare as a whole only counts for a narrow proportion of overall health outcomes. So there's this big area that is much more important in our view, which is around socioeconomic factors. So how much income people have, their employment prospects, skills, education, housing. There's all these kinds of things that are really important, which often get missed off the agenda when talking about health.
I very much welcome the CPP report because it is timely, and it's important that we not only concentrate on cure of disease, but we begin to focus much more on curbing ill health. And the report broadens the agenda, looking at those elements of social determinants that are so important for the longer term. It's crucially important to engage those professionals who are going to sort of deliver the message. But if it's going to succeed, what we need to do is persuade the public at large.
You can build relationships, you can actually work out what everyone has an interest in locally, and it's different in different areas. For instance, it might be housing in Barking, but it might very well be very different in a rural area such as Cumbria, which might be transport that's important. The NHS can act both as a leader and an influencer, so it can be a cooperator, it can be a coach about health and health expertise, it can support and educate those in the institutions such as schools, colleges and higher education institutions. It can influence the kind of courses that are available.
So what does socioeconomic inequality mean in practice? Well, in the report we use this 80 million figure, and that's the number of years of life lost for the entire population of England alive today. And that's broken down to around 1.5 years per person. And also we look at healthy life years, so that's the proportion of overall life that is healthy, and that's even bigger, that's around 3 years. So if you want to find out how many years of life lost you have in your local authority, I'd encourage you to use our interactive tool on our website.